One thing that confuses a lot of people is why high blood pressure is bad. And I totally get it. I mean, we need blood pressure in order to survive. Blood pressure is responsible for driving blood flow, and we need blood flow to our organs in order to keep us going. High blood pressure is bad for a lot of different reasons, but I'm just going to hone in on my favorite, or the simplest one to explain. Remember, blood pressure is the force exerted by circulating blood on our vessel walls. If we have a higher pressure in our vessels, that's a higher pressure that our heart must pump against in order to overcome resistance and induce forward flow. This will basically increase the pressure that we see within the cavities, or we can say the left ventricle of our heart. Now we have to do math. This is Laplace's law, and Laplace's law governs wall tension within any fluid-filled cavity. This includes pipes, balloons, and even your heart. If there's one thing to know about cardiomyocytes or heart muscle cells, it's that they hate wall tension. I mean, who doesn't hate tension? It's stressful. No pun intended. So we can see in Laplace's law that if we increase the pressure within the cavity of the heart, that's going to also increase wall tension because that's on the other side of the equation. And remember, like middle school, it's like do unto one side as you do to the other. So if you increase this side by like 2, you got to increase this side by 2 or something. So anyway, increased transmural pressure will also mean an increase in wall tension. And since the cardiomyocytes hate wall tension, they'll do anything they can in order to offset this. And they do this by increasing wall thickness. See how it's in the denominator? So an increase in transmural pressure can be offset by an increase in wall thickness, thus normalizing or reducing the wall tension. And studies show that within mere hours of seeing increased tension and pressure, that cardiomyocytes will already start to increase synthesis of actin and myosin filaments. They will begin to add sarcomeres, or functional units of muscle cells, in parallel, thus making the heart muscle thicker and stronger. After years of this, you can go from having a normal heart here to a thickened heart here. This is called concentric hypertrophy, or left ventricular hypertrophy. Now I know what you're thinking. I go to the gym all the time and the gym makes my muscles grow, and muscles growing means that muscles are getting stronger, and isn't this a good thing? Well, in the rest of the body, yes, it's a good thing, but in the heart, no. When the heart becomes thickened and stronger like this heart here, it's going to require more oxygen and nutrients in order to function. And the tricky part about left ventricular hypertrophy due to hypertension is that the heart will increase the number of muscle cells, but it won't increase the number of capillaries. And we need coronary capillaries and arteries in order to supply our heart muscle with necessary oxygen and other nutrients so that they can function. And by increasing the demand of this tissue for energy without increasing the supply via the coronary arteries and capillaries, you're setting up a recipe for ischemia. Ischemia is due to lack of blood flow, and sustained ischemia can lead to necrosis or tissue death. So left ventricular hypertrophy due to hypertension makes you more susceptible to heart attacks. Let me know in the comments what you'd like to see next, and follow if you want to see more content like this. Thanks.